Okay, now let's take a look at hyperglycemia, when your blood sugar is way too high. Now, generally the onset of this is slow, usually over the course of 1 to 2 days, something along those lines, okay? Now, the problem is you've got a very high serum glucose, okay? Which means that your blood becomes hypertonic. And when your blood becomes hypertonic, you're going to increase urine output. And that's one of the ways that we can get rid of excess sugar automatically, excess glucose automatically. All right, your kidneys are going to let that glucose, you're going to be dumping glucose, is the slang term for it, into your urine. Okay, and because you're urinating a lot, you're going to get dehydrated very, very, very quickly. Okay, and because you're getting dehydrated means that you're going to be thirsty and be drinking lots and lots of water. Okay, so it kind of goes along with the signs and symptoms of hyperglycemia. You're going to get fatigue, you're going to be lethargic, dizzy, weak, slurred speech. Sounds a lot like hypoglycemia, okay? But remember, this onset is slow, whereas hypoglycemia, the onset is usually under an hour and faster. In addition, some clues are that you are urinating a lot, polyuria, you're very thirsty, polydipsia, you're getting dehydrated. You may also be unconscious, okay? And also the patient may be vomiting and or complaining of abdominal pain, trying to get rid of all that excess sugar. Okay, so there are some subtle nuances. Okay, the patient is also going to be hyperventilating. They're going to be breathing very deeply and very quickly, and it's beyond the scope of this video to explain why. Okay. Now the treatment, once you've done a finger stick and you realize that their blood sugar is through the roof, the treatment is insulin and actually a bunch of more medications that you need to give the patient, but again, that's beyond the scope of this this video. And because the patient's dehydrated and are hypertonic, you want to give them IV fluids to bring them back to normal hydration status.